It's known that some believe that the United States should enact federal health care, but there are a variety of reasons as to why that's not the correct answer to our problems. One example is that a federally controlled healthcare system would create major economic and healthcare disruptions, as well as taking away an aspect of freedom to our civilians. Universal healthcare could also reduce quality, efficiency, and personal choice in our country's healthcare system. While the current mixed system in America is imperfect, replacing it with a large federal program is not the best solution. If federal universal healthcare was enacted, it would place enormous financial pressure on the government and ultimately the taxpayers. Healthcare is already extremely expensive, and putting the federal government in charge of covering healthcare for millions of Americans would result in massive increases in governmental spending. That money has to come from somewhere, which potentially means higher taxes, more national debt, or cuts to other important programs such as Medicare. Specifically, universal healthcare wouldn't only be a choice, but a commitment in a variety of ways. One 2022 article states that universal healthcare, quote, needs not only strong political commitment, but also a coherent strategy to ensure that the different aspects of health systems are aligned and coordinated with each other in order to effectively address core performance challenges, end quote. Government-run systems are also known for inefficiency and bureaucracy. Large federal programs frequently struggle with waste, delays, and overspending, and healthcare would be no different. Instead of improving the system, federal universal healthcare could create longer wait times, overcrowded hospitals, and slower access to specialty providers and procedures, as well as economical costs. The United States is one of the nations that leads the world in medical technology, research, and pharmaceutical development, largely because of competition and private investment. If the government controls pricing, funding, and access to care, there is less incentive for innovation and improvement. A 2023 article describing the American healthcare system states, quote, "The United States leads the world in new drug and medical device approvals, holds the distinction of having the highest number of Nobel laureates in chemistry and medicine, and produces the second highest impact of scientific works in the world. The degree of medical specialization in the United States is also among the most advanced in the world," end quote. Countries with universal healthcare systems often rely on medical breakthroughs developed in other locations, such as the US, while also struggling with ration care, long wait lists that are possibly due to the universal health coverage they have enacted. Equal access does not automatically mean equal quality care or treatment. If everyone technically has health insurance coverage, but patients wait months for treatment, then the quality of care decreases overall. Lastly, many Americans greatly value freedom and personal choice. Under a federal healthcare system, the government would have greater control over what patients can see, what procedures are covered, and how resources are distributed throughout the system. Many Americans do not want federal agencies making healthcare decisions for them or to be involved in their healthcare at all. A mixed system allows individuals to choose plans and providers based on their own needs instead of placing everyone into one standardized system controlled by the government. The affirmative claims universal health care would prevent people from delaying care until conditions become emergent, protecting patient safety and also lowering costs. The response to that is that, however valid, insurance is not the only reason people delay treatment. There are a variety of other reasons why this happens. People also avoid care because of transportation issues, fear of missing work, lack of providers, or distrust of the healthcare system causing apprehension. Even countries with universal healthcare still experience delays because overcrowded systems create long wait times for appointments and treatment. Expanding federal healthcare does not immediately guarantee faster access to doctors, or treatment if the system becomes overwhelmed. An overwhelmed healthcare system would place a burden on everyone involved: the healthcare workers, the patients, even the governmental spending. That doesn't even mention the struggles of our healthcare workers that are already experiencing, including a constant struggle with staffing and burnout. Another perspective that can be argued is that emergency care, which is at an all-time high due to health insurance inaccessibility, costs more money than preventative care. While preventative care can reduce some emergency cases, federal healthcare does not remove costs associated with the emergency room visits. It transfers those costs onto taxpayers to instead make up the difference. When healthcare becomes governmental funded, demand increases dramatically because more people use the system and more frequently. That can overwhelm hospitals, increase inefficiency, and still result in rising healthcare costs. Overall, targeted reforms to our current mixed healthcare system can improve affordability and access without creating a massive federal system that risks lowering quality and increases governmental control.